Dr. Cruz, if you can come up to
I will ask.
the dais.
I will ask Dr. Adela Cruz to please come forward.
Mr. Mayor, as Dr. Cruz comes up, I'd like to do a brief introduction to her work and what she does. I don't know if it would be more comfortable if you wanted to stand or sit, Dr. Cruz. It's up to you.
I'm sorry?
If you feel more comfortable to sit up here, if you like, if we can do that, Mr. City Manager.
Would you like to come around and sit down back here, or would you feel okay to standing and talking the way it is?
Okay, I've been sitting for a while.
Okay.
That's fine.
So let me ask, Mr. Mayor, because this is just to put us all into a context of why Dr. Adela Cruz is here. Those in the audience, how many of you have children? Many folks talked about having families. How many of you have siblings that are of adolescent age or children of adolescent age? This evening, we heard a lot in public comments about the struggles that families have in their jobs, in where they live, in their neighborhoods, the ability to get home on time to be with their children. In our city, with our two major school districts, Anaheim City Elementary District has almost 2,000 children who are homeless, living in cars, motels, garages, or in unstable housing. The Anaheim Union High School District has 3,000 to 4,000 children in the similar conditions. So that's about 5,000 kids in our city who have unstable housing environments. Over the last several years, our city has engaged heavily in trying to figure out how to best support our families who may be homeless in our city. And while we talk a lot about families and children, we don't often get a deep understanding of what that really means. And that's why I asked the council, and really grateful for council members who agreed to agendize this. And that's what we're going to hear this evening is a presentation from Dr. Adela Cruz with her work in our high school district. Dr. Adela Cruz works with our Anaheim Union High School District, currently serves as the coordinator for the school mental health, homeless education, and foster youth programs. Her additional duties include the supervision of a team of 15 clinical social workers and other support staff. She has worked as a social worker in the CalWorks Welfare to Work program to address barriers to self-sufficiency and the in-home supportive services IHSS with the elderly, the blind, and disabled. As a psychotherapist in the private sector with victims of crime, she's worked as a co-chair for the Collaboration to Assist Motel Families and is a co-coordinator for the yearly back-to-school outreach event that serves over 500 homeless youth here in our city and in our school district. She is involved with the Be Well OC Foundation and its community efforts to improve mental health services in the area of crisis response and suicide prevention. Her doctorate work concentrated on organizational structures and systems in schools for children and youth with mental illness. Dr. Cruz has been a presenter at several state conferences, including the California Association of Bilingual Education, the California Association of Supervisors of Child Welfare and Attendants, and the California Student Mental Wellness Conference. She lives here in Orange County with her family and 2 teenage children and 2 dogs and a cat.
Yes.
That's in her bio. So I'm really excited that you're here, Dr. Cruz. Thank you for responding to our request to come speak to our council. The reason this was important, ladies and gentlemen, I want to actually acknowledge Trustee Al-Jabbar is here, also Chief Academic Officer Manuel Colon is here, is that we just keep hearing these stories, and Mr. Brandman agendized, and there's an ad hoc committee to look at a temporary emergency shelter on the west side that, from the ad hoc committee's report, will seek to serve families and children as a priority because there's such a need in our city. So I thought it was important that we understand the roots of this and what our school folks are seeing day to day that often we as families and as parents try to figure out without realizing that it's happening. So Dr. Cruz, the floor is yours, and thank you for coming.
Thank you, Mayor Sadu, council members, and Councilmember Moreno. Thank you so much for this opportunity. I'm hoping to be able to give you information just to raise awareness in terms of the human need, because I think we talk about mental health and homelessness politically at the national level, at the local level, but I'm hoping to bring you deeper insight in terms of what that means for our children, for our youth, and for the people that work with our kids within the educational system. So I'm going to give you a little bit of scope of mental illness and homelessness. What is the scope? Highlight the impact that these issues have on our children and our families as well, and the rationale why it's important to continue to invest in our youth, our children and youth, in the area of mental health and homelessness. And of course, we always want to talk and look at what we're doing very well. And I'm very proud of our district in terms of all the great things that we're doing for our kids and the many opportunities that they have to do well and to be well. So that's always important to highlight the great things that are doing it. For the most part, most of our kids are doing well. They're on track to graduate. They're on track to go to universities. And a smaller percentage, unfortunately, a smaller percentage of our kids are not doing well. And they're not on track to graduate and to become productive members of society. So who are our most vulnerable kids? And again, I've been working in the behavioral health care world, social services world for about 30 years now. And I came into the profession for personal reasons. I have a sibling who has struggled since he was 15 with mental illness and does to this very day. I've had the privilege to work with individuals, families, children, and hear their stories in terms of their suffering, their hopes, and why they can't achieve those hopes. So I bring both a personal and a professional perspective in terms of why this is important. Who are our most vulnerable? I have to say, obviously, our homeless youth, our foster youth, kids who are involved in the juvenile justice system are also at risk, LGBTQ. But I want to highlight the last bullet point, and that is that all of our kids are at risk. And as I go through the presentation, I'll try my best to explain why that's the case. And the risk factors for our kids, the ones that we're always talking about: poverty, a huge risk factor, poor health, both mental health and physical health. It's important to highlight the fact that physical health is also important for our kids. Social, cultural factors, things that happen on a day-to-day: divorce, abuse, neglect, violence, and the political and economic factors as well that affect our kids. So, important terminology: mental health versus mental illness. Oftentimes we talk about mental illness. We say mental health, but we really want to be very strategic and speak to the fact that we are referring to mental illness. And how do we define mental health? Mental health is our ability to perform our tasks, to achieve our goals, to manage stress, to have healthy relationships. And what I'm going to try to highlight for you is what does mental illness look like for individuals that we're working with, and that the fact that it affects a person's cognitive abilities, their emotions, and their physical and behavioral well-being as well. The data is very compelling, and we can say that 1 in every 5 Americans will have a mental health disorder. 90% of individuals who commit suicide had a mental illness. What the data doesn't tell us, however, is that we see these issues starting early, and now we're seeing them as young as early as elementary. We have children that are coming into 7th grade with mental health problems. The data doesn't tell us that if we don't get to kids early and provide some intervention services, now you have lifelong suffering. 50% of lifelong cases of mental illness begin in adolescence, and now we're seeing that it begins early. The data doesn't also tell us that there's an increase in number of students who are developing severe mental illness, debilitating mental illness, like psychosis. Since I've started, I've been working for the district 10 years. And the first year I started keeping data in terms of the kids who are dealing with psychosis like schizophrenia, we found 13 years. And because we're doing such good work in finding students within our district who have a mental health condition, those numbers kept going up. And every year we keep getting an increase in number of kids that are developing mental illness, and it's developing at a younger age as well. 10 years ago, you'd see onset of psychosis at about age 15, and there were very few and far between. And now we're seeing them as young as 10, 11 years old, and we see kids that are developing psychosis. And of course, suicide is a huge issue. What the data doesn't tell us is that there's a path to where a person becomes suicidal. They've oftentimes suffered for years. And we oftentimes find them when they're already in this critical state, when they're already been through so much suffering that their only alternative is to take their lives. And when we look back, when we conduct our assessments and work with the family and ask questions, we see that had we gotten to them 2 or 3 years earlier, we could have prevented lifelong suffering and perhaps that person from developing severe mental illness, which is what we all want to do. On the issue of homelessness, there's 2 pieces of legislation that define homelessness for us. We all know HUD's definition, the McKinney-Vento Homeless Assistance Act, however, expands that definition for us. It's a specific legislation for school districts. And these are kids that are living out in the streets, they're in motels, but it also includes kids who are doubled up. And they're renting a garage or a bedroom, not by choice, but due to economic hardship, because they cannot afford to buy their own home or rent their own apartment. So our numbers are higher because we've included the doubled up population in the definition of homelessness. And what does that look like in terms of our youth? 69% of kids who are on the streets and homeless have a mental health problem. 33% of them were in the foster care system. 50% of kids who are homeless are involved in the juvenile justice system. When it comes to behavioral problems, when it comes to mental health of kids, they're oftentimes disengaged from the educational system. So if they're not at home, and if they're not at school, they're out in the streets. And when they're out in the streets, they're going to do things sometimes because kids take risks. They do things that are inappropriate. Their first involvement with an institution is law enforcement, instead of it being with a social services or a mental health care agency. So, and we know that once kids begin to be involved with the juvenile justice system, it's just a revolving door. It's much harder for us to get them back. What is the impact of homelessness? When I first started working for the district, the first family that I met with wasn't even in our district. It was an 11-year-old, it was a mom who was working part-time in a local company, living in a motel, and brought in her 11-year-old daughter. And they came to see me. They heard about me. I had already been there for about half a year. And they came to see me because they were looking for food. And I had never, and I've been around for a while in the profession, and I had never seen what a child looks like who had not eaten. She had not eaten for about a day and a half. And the look in her face, I still get emotional this day just to remember, it's imprinted in my mind how we have children in our communities who are living in motels and have no food to eat. This is what we're looking at. So again, we all know the numbers, we all know the data, but what does it look like in the real world? We have families, and again, this is an issue, this is not an AUHSD issue, I just want to say, this is happening everywhere, right, in our communities. We've had families who parents grew up in motels and their children are now in motels. We've had a recent family who 3 generations are living in motels. So it begs the question, what is it that we're not doing? What is it that we need to do different? Because when we have generations of families who are growing up and living in motels, there's something that we're not doing right. What's missing? When it comes to homelessness, families are living in the moment. They're in crisis mode. They don't necessarily have time for preventive care. We have students who are suffering from malnutrition, kids who obviously have mental health problems or an increase of mental health problems because of what they're experiencing. Kids who are living in shelters and motels are on the streets. They're more exposed to violence. There's no stability. There's no sense of safety for them. So obviously, there's going to be an increase in mental health. When it comes to the urgency of this and why this is important, because kids are dealing with psychosocial issues that impairs the way that they think and they feel and behave, they begin to experience failure. They stop coming to school. And it's true for any human being, once we start experiencing failure, that makes the way that we think about ourselves, the way that we feel about ourselves, it makes it even worse. So you have kids who already have psychosocial problems, they begin to fail in schools, and it exacerbates their symptoms. It makes it worse. And when we talk about youth well-being, when we talk about these psychosocial issues, what is it that we need to ask ourselves in terms of how to prevent them from getting worse? When it comes to working in schools, what has happened in the past 3 decades, there have been efforts to address the social emotional needs of kids. And I think there's been a shift, and it's been a very important shift, in that we need to look at this through the mental health lens. And what does that look like? So we're looking at what are we doing to promote well-being for kids that are doing well, and then what are we doing with kids that are already having symptoms or they have a diagnosable mental illness. And you look at all those kids that we mentioned earlier, kids who are in foster care, kids who are homeless, kids who are dealing with poverty, kids who are engaged in the juvenile justice system, and then all of the rest of our kids. We are seeing children who are from healthy families, they have all of their basic needs that are met, and they're coming to us and they're having serious mental health issues, serious anxiety disorders, mood disorders, psychosis. And that puts them at risk for homelessness, as I will explain in a little bit as well. So we have to look at the full spectrum of mental health when it comes to our kids. We're talking about issues like homelessness and mental illness. It is looking at the whole child, the well-being, and all of our kids, not just the kids that are at risk. Why is the opportunity of education important? Youth with mental illness, youth who are homeless will drop out of school. And lack of an education leads to the inability to maintain employment, to gain employment, to maintain it, to increase their income. And then we have more problems with homelessness. If we don't address these issues early, individuals who are not graduating with an education, that are not going into the world with a career, then we have an increase in the population as far as unemployment, more homelessness, more poverty, and then kids who are obviously still growing in motels, like the generational issues that I just described. The consequences of not addressing mental illness or homelessness, we want to say that not doing this, we have lifelong issues with suffering. Research tells us that individuals who have a mental illness, life expectancy is reduced by up to 10 to 15 years. They are more likely to be stigmatized, they are more likely to be discriminated, and then that leads to an increase in their symptoms or severity of their symptoms. We know that 25% of Americans who are homeless have a serious mental illness. 45% have a debilitating mental illness, where now you have an organic disease that is debilitating and disabling. 50 to 70% of youth in the jails right now have a mental health disorder. And when we don't address these issues successfully with our kids, everything that we talk about stigma, discrimination, homelessness, school failure, these are things that we're just going to keep having to address, having to spend more and more money. And we won't be able to fix the situation. I see clearly that if we can get to kids younger, that we can identify them early, get them the help that they need, we can begin to work effectively in the area of prevention, which the educational system has tried to do, and the behavioral health care system has also tried to do. And for some reason, we haven't been very, very successful at that. So the investment rationale, and I'm talking about schools. Why is this important? So we invest in the social development of our kids, in the mental health wellness of our children, and our physical health. We're going to give them what all children need. All children need to feel secure, to have a safe place to live, all their basic needs met. If we can do that and we can give them significance that they belong, that we're going to take care of you, and these are the people that are going to be taking care of you, create those connections, they're going to have a sense of belonging. Their needs are being met. We're going to give them hope and be able to re-engage kids who are not engaged with the educational system, and keep kids who are struggling. We'll be able to keep them and support them within the educational system. And of course, it'll increase all the other things that we've been talking about here this evening, is opportunity, being able to take care of their families, being able to have a job, take care of themselves, and reinvest in their communities. These are all things that are very important if we strategically invest in our kids and address these issues as early as possible. And that's my presentation. Thank you. I'll take questions or comments.
Councilmember Moreno.
Thank you, Dr. Cruz. One of the things that I've been thinking a lot about, and part of what created the motivation for me to invite Dr. Cruz, is I attended a session she did at the Parent Leadership Conference hosted by the school district with 300 parents who were just enthralled, and like light bulbs were going up.
Yeah.
Dr. Cruz, so for the folks who are here in the audience today, I'm thinking as a parent, those of us who are parents or have little brothers or sisters in the schools, what can we do? Is there a place? Is it just simply the parents can deal with this on their own? Are they trying to deal with it on their own? Can they deal with this on their own? Do we allow peers to help peers? Or is there a role for our agencies, our city, our school district? Of course, you're doing the work, but what can we do?
I think that what we're doing is working right now. And what we're doing is we have mental health care professionals within the educational system. And they're helping staff, working with staff to identify kids who are struggling. Historically, the educational system has reacted to behavioral problems and punitive measures. We're trying to change that. Our district is doing a good job in changing that. But we need to get to a point where we understand that there's a reason behind the behavior. There's always a reason behind the behavior. When parents understand that, when educators understand that, when we have mental health professionals addressing what's behind the behavior, because now we know that it's living in a motel and you don't have food, or you're dealing with a psychosis or a mood disorder, or you're in the foster care system and you have trauma, you have history of abuse. Now we're dealing with the issues. And we are sometimes hand-holding families, and families want to help their children. Sometimes they don't understand what's wrong with their children, and let alone navigate the system. The navigating the behavioral health care system is so complicated, even for those of us who are professionals, is difficult. So we sometimes hand-hold our parents. Sometimes we sit them down and we educate them the importance of that relationship and how they need to re-engage and understand what's happening. So I have to say that we have to look at it, at investing. Where do we find our kids every day? They're in school. And who identifies these behavioral issues first? It's our teachers. We're asking them now to not just teach, but to address these issues. They need our support. Our counselors are doing a great job, our psychologists, our administrators. But you need that one person who understands the complexity of behavior, the complexity of mental health, to be part of that team. We need agencies to come in services, and we do have a lot of partnerships because we can't do it alone. So it's partnering with agencies. But the thing that has the most impact in a school setting is adding that mental health professional to that team so that we can support.
So, Doctor, I know that we're somewhat limited time, but
Yeah.
there are the schools, as a parent, I know that I've gone through LCAP, which is local control funding formulas, where parents are advocating for this, communities are advocating. It doesn't seem to be enough. Cities certainly don't have the budgets targeted in this way. My understanding is that a lot of the mental health resources are at the county level. We've seen that with our homelessness work, that a lot of resources gets captured there. We don't see it come out to the cities, which is something we've been struggling with to do that in partnership with the county. Are there resources at the county level that are targeted, federal money, state monies, that are deposited into the county that should be going out to, and this might be a little politically
Yeah.
difficult, but are there monies there that are just not coming out that would be helpful in the school setting and in neighborhood settings, which schools are in?
Well, I think districts have to be creative, and they do get increased funding through the LCAP process, but it's obviously not enough because they're mandated to educate. But there are funding, and there are funding resources that are coming to the counties through the Mental Health Services Act, millions of dollars that are coming for the purpose of addressing mental health. And through Prop 63, that legislation was passed with the purpose of finding individuals, children and adults who have mental health problems already and preventing those issues from becoming a disabling condition where they're now being in a situation where we need to take care of them as opposed to building them up. So the fundings, most of the money is being used well. There's a lot of agencies in the community that we work with, that we connect families to. But there's monies there that, in my opinion, I think could be redirected to schools to help us build more mental health services within the educational system. The important question to ask when it comes to these things is, who's finding children? Because there's a lot of agencies out in the community. There's a lot of services out there. There's plenty. But who's identifying the kids that have a need? And then who's helping assess what those needs are? Because there are many. Who is connecting them and helping them link to the services? And then most importantly, because more than 50% of students with mental health problems do not get treatment, who's treating kids who, for multiple reasons, can't get to the services? Somebody has to treat them. And if we don't, it just gets worse.
And Dr. Cruz, last question for me is, so for folks again here in the audience or watching at home or who will watch this on cable TV as it loops, is what symptoms should parents, grandparents, adults look for or that are signals that perhaps they should talk to someone at their school site, a teacher, a counselor, about behaviors that they're seeing? What would be some of those symptoms or behaviors that you would recommend we keep our eye on as adults in our community?
Yeah, and when I talk to parents, I tell parents that they know their children better than anybody. No expert can come in and tell them that they know better when it comes to their children. But I think that that's a great question. You have to see if your child is isolating. For example, if something recently happened or behavioral issues are becoming more intensified, their symptoms are becoming more anxious, more depressed. And the way that looks is the kids just want to isolate. They don't want to engage with families. They stop doing things that they typically enjoy to do. They don't want to go to school. Their grades decline. They're more irritable. And
isn't that just teenagers? That's what I hear a lot.
Some of it
That's
is, yes. And some of it is kids who have healthy protective factors will navigate problems and stress and have normal reactions, but go back to healthier functions, levels of functioning. Kids who have a serious mental health condition or beginning to get worse will continue to get worse. And within 2 or 3 weeks, you should see improvement. If you don't, then that means that something's wrong, that they need to ask somebody, and they shouldn't be afraid to ask. Yeah.
Thank you, Dr. Cruz.
Thank you.
Those are all the questions I have, colleagues.
Does anybody else have any questions, any council members?
I do.
Okay, Councilmember Barnes?
Yes. Thank you so much for your presentation. I was following the Unlimited You through the last 7 months or so, and it was very informative, especially that parents actually came out and participated with their children. One of the very startling things that I find in my home is the gaming, all the technology that kids engage in. And there's not really that human element of communication. What we used to do was games and other things like that is very, oh, Mom, we don't do that kind of thing.
Right.
But to me also, I realized is there isn't a manual that says this is parenting 101. Mm-hmm. And a lot of people start out at that age. I don't know what to do to get my child nurtured. The things that you're suggesting, food, I mean, that's just like common sense, but people are, I need this and I need that. and it's all about the need and stuff. And instead I'm going like, is there any way that we can start a parenting class for young people that are just so, I have no clue what to do now, and I'm depressed because I don't know how to treat this. And so it just rolls out to where nobody's addressing right here at home who's the head of the house, and next thing the kids are 3 and 4, and I mean, I watched enough of Nanny 911, and the kids are the ones running the house and telling the parents. So to me, especially the marriage family therapy component, which is what one of our nonprofits, Higher Ground, has, is another wonderful tool for parents to go to and say, you know what, I don't know, but I really would like to. Are those any things in your toolbox that you're dabbling with, and could it support that?
We are building parenting workshops. We do parenting classes to build skills. Parents are coming. They do come. What's happening and what's great is that the more we chip away at stigma, the more we talk about mental health and mental illness, the more training that we do for our staff, or the more workshops that we do for our parents, the more aware they are that they need help, and the more aware that they are there's something may be wrong. So the higher our numbers. So parents understand. Once we help them understand what they're seeing and what skills they need, they want those services, and we're already doing some of that, and it's helping. We focus on the relationship. The relationship that we have with our children is critical. Social media and technology doesn't help with that, because kids oftentimes they resort to technology. But that relationship component is key to the work that we're doing with our parents, and helping them understand the importance to stay engaged with their kids and to continue to build that relationship.
What I got from the Unlimited You, especially from the teachers, is that parents are expecting them to do the parenting job. And that's just like, so I have a curriculum, I have to meet those standards, and this is where I would like to get. But when you have children that are carrying such a big burden and not knowing, first of all, who I am, what gender, you know, where do I belong? And then that cartoon you had up about I'm alone, you're like, how could you be alone, you know?
Well, that's how they feel.
Exactly.
That's what they're thinking.
Exactly.
And that's why they need the help, because that's not the case.
Yeah, so I'd like to think that parents can learn how to embrace that challenge before them, and then have the tools to get through that with their children.
And we work heavily with parents. That's an important piece when you're working with kids. Absolutely.
Thank you very much, Dr.
Thank you.
Cruz. If there is any other questions from any of the council member, I really appreciate your presentation on homelessness, mental health, and mental illness. This was very valuable, great subject for at least be public to know that people who live in Anaheim.
Thank you so much.
Thank you. This was just... Next item before us